You know Miami, right? Miami. All-night parties, champagne everywhere, supercars cruising down the boulevard. A tropical paradise that never seems to sleep. But have you ever wondered why the streets look so miraculously clear of homeless people? It is not because everyone suddenly found a home. The truth is, Miami is not just cocktails, luxury, and bright beach lights. There is another side of the city. A tough sweep campaign is happening.
So we go out into the community, go on the bridges, we scour the sidewalks, we go on foot. Sometimes we just take the van and we walk down certain streets. So there's different tactics that we use to be able to make sure that we're getting an accurate count.
Police are using drones over the dunes, searching every hidden corner where people might be staying. House Bill 1365 has now kicked in, making outdoor sleeping illegal across Florida.
It's really important for us to do these activities because it kind of gives you the heartbeat of what's really going on with the homeless community within the city of Miami.
Mayor Stephen Minor even called it a huge success. But is it really? Did homeless people actually disappear? Or were they simply pushed out of sight? Because behind those cleaner-looking streets, there is a hidden reality. Around 66,000 people in Miami are considered hidden homeless, including up to 11,000 children. Instead, they're crashing on friends' couches, staying in cheap weekly motels, or constantly moving around so nobody notices. You get it.
Try to stay as warm as possible in the tent. I fought through the hurricane, so I can stand a little cold.
Meanwhile, rent has soared by 80% since 2019. Even people with steady jobs are starting to fall behind. So, what's really happening here? Is Miami actually fixing the problem? Or is it becoming a showcase for a new approach? The trend of criminalizing homelessness rather than the old housing first model that prioritized getting people into homes. Before we dive deeper, the numbers, the hidden struggles, the people quietly slipping through the cracks. It all comes back to one thing: the law. You might think, if the streets look cleaner, if fewer people are visible, isn't that progress? Sounds reasonable, right? But what if that progress is only on the surface? In the next part, we'll break down this new law, how it works, why some praise it, and most importantly, what it's really doing behind the scenes. You got it. Let's dive in. Miami Beach just recorded its lowest unsheltered count in nearly 3 decades. Only 93 people were found sleeping on the streets during the January 2026 point-in-time census. Florida's HB 1365 makes it illegal to sleep in public spaces statewide. It looks neat on paper: no tents, no overnight stays, no visible encampments. In 2025 alone, Miami Beach police reported about 800 arrests for sleeping or camping outdoors, 3 times the total from the year before. Refuse to go to a shelter and you're handcuffed immediately. Bail is roughly $150. Cash most people living on the street don't have.
There's something about being locked down inside that I can't be real comfortable with. Curfews and all that, so I'm a free spirit. 6 years military, so I think I can handle it.
Drones conducted over 40 missions last year, locating 80 hidden makeshift camps tucked in the beach dunes. On the ground, crews installed concrete spikes and sharpened metal studs on park benches, bus shelters, and seawalls. Classic hostile architecture meant to make sitting or lying down painful. No soft spots to rest anywhere. The city itself has been designed to push people off the streets.
We're not trying to be a nuisance, so we didn't really have a choice in that because they told us to 1:15 Friday, don't pack up our stuff and be ready by 4 o'clock, and they didn't tell us where we were going or anything.
Think about going to a shelter. Not easy. They're overcrowded. The rules are strict, and there are countless disadvantages waiting inside. And when someone is arrested and jailed, it costs the city $294 per day per person. If hundreds or even thousands of people end up behind bars, just how high does that bill actually go? You can picture it, right? The city is clearly burning through huge amounts of money just to shuffle people around instead of providing real stable housing. And after a couple of months when they're released, they end up back on the streets. There's no affordable housing ready and no real long-term support system waiting for them. It's a fast-moving, revolving door dressed up as progress. If you're constantly forced to move, how can you ever stabilize your life? So, when the mayor steps up and celebrates 93 unsheltered people on the beach, ask yourself the tough question. Did we actually solve anything, or just make the problem less visible? Because right now the drone footage looks perfect. Benches remain empty and the real numbers are quietly rising in the neighborhoods nearby. The largest piece of Miami's homelessness crisis is the piece most people never notice. This isn't about tents on sidewalks or people sleeping in parks. Those cases are visible, easy to count. Easier for officials to manage. The harder group to measure and the more vulnerable one is the hidden homeless population. Current estimates suggest about 66,000 people in Miami-Dade County are living without stable housing. And out of that group, roughly 11,000 are children. They are not officially on the streets, so most public counts miss them. Instead, they move through whatever survival option is available. Couch after couch, weekly motels, sometimes cars, no lease. No safety, no permanent address. And that part, not having an address, matters. Without one, services become harder to reach. Healthcare is inconsistent. Keeping a job gets much harder. Life turns temporary, unstable. One missed payment, one fight with a host, one rough week, and they can fall directly into street homelessness. This isn't some separate group, it's the feeder system, and it's getting bigger. Now tie that to the cost of living. Rent in Miami has shot up dramatically over the past few years in some neighborhoods, as much as 80% since 2019. Wages not even close to keeping pace. So what happens? People working full-time, sometimes at multiple jobs, still can't cover basic housing costs. That's what insiders call the working homeless. They have jobs, they function, but they don't have a place to live. If you're working every day and still have nowhere to sleep, what does that say about the system? And here's where it gets uncomfortable. When these people aren't visible, they're easy to ignore. No complaints, not on street counts. Politically, they barely exist. But in practice, they're the majority. While the public conversation focuses on the streets, real pressure is building in apartments, motels, and borrowed spaces all over the city. And if that layer breaks, you don't see a slow rise, you see a sudden surge. But here's the tough truth nobody wants on the evening news. While the arrest numbers look like a victory on paper, the real-world impact is hitting hard and fast across Miami-Dade. On the positive side, big money is finally flowing. A $5 million grant from Bezos is helping families stuck in weekly motels. Another $21 million in federal funding is adding extra shelter beds, and a few programs are actually flying people back to their home states when family is waiting. Sounds solid, right? You got it. That's the official "we're doing something" story. Flip it over and the picture gets ugly fast. This crackdown is straight up criminalizing poverty rather than solving it. Each arrest still costs $294 a day in taxpayer money, and with hundreds cycling through the system, that adds up to millions spent just to shuffle people around. Families and kids are bearing the brunt. The hidden 66,000 are drowning in stress, missing school, skipping doctor visits, and living one eviction notice away from complete collapse. The root problems, sky-high rents, dead-end jobs, zero affordable housing, haven't budged. We're not solving homelessness. We're just moving it around and calling it progress. Here's the part that really gets people angry. Advocates are calling it what it looks like: exporting the problem. Push unhoused people out of Miami Beach and they simply show up in the city of Miami or North Dade, putting more pressure on those communities. Ron Book, who leads the Homeless Trust, was blunt. He basically said the jail approach is a foolish money pit that fixes nothing and only creates a revolving door. People are released after 2 months with no real long-term support, and then they end up back on the street or in another motel because the housing was never built. So here's the big controversial question. Are we actually helping these families stay afloat? Or are we spending public money just to keep the beach looking nice for tourists, while the human cost grows out of sight? The numbers are clear. More shelters and grants are a beginning, but without real housing. For solutions, this is still an expensive game of musical chairs with real people's lives. That's the full survival picture in early 2026. Some money moving, a lot of pain moving, and a city still debating whether the success is real progress or just displacement with better packaging. Health usually gives out first, long before housing disappears. Out here, it rarely happens as one dramatic crash. It's a slow, steady grind. Skip medication. Broken sleep, bad food, heat beating down, then everything piles up fast. Most people on the street or moving through unstable housing are already managing chronic problems: diabetes, heart disease, breathing issues. Add mental health strain, anxiety, depression, untreated trauma, and you have a system under pressure with no real safety net. And the key piece is access. No ID, no insurance, no permanent address. That mix alone can shut people out of normal health care. Clinics need documents. Appointments require stability. Prescriptions require follow-up. None of that fits a life that changes daily. If you don't know where you'll sleep tonight, how are you supposed to manage a long-term illness? So what steps in street medicine? Mobile teams, doctors and nurses go to encampments, sidewalks, and motel clusters. They treat wounds right there. They manage illnesses with whatever resources they have. It's practical, it's urgent, but it only goes so far. Because they're not repairing the system. They're holding it together temporarily. Now add mental health. Without steady care, small problems grow. Focus slips. Decisions get harder. Holding a job gets shaky. Relationships weaken. And just like that, the path back into housing narrows. What happens when your mind is under constant pressure and there is no stable place to recover? This is where the cycle tightens. Health gets worse, leads to work gets harder, leads to income falls, leads to housing becomes impossible, leads to stress rises, leads to health gets worse again. And here's the part people don't like to admit. We often talk about health and homelessness like separate problems, but on the ground they're one system. Break one and the other breaks two. The system isn't broken, it's doing exactly what it was built to do: reduce pressure quickly. Right now, Miami is running a patchwork of interventions. Shelters are expanding capacity temporary housing, like tiny home villages are popping up, and outreach teams are hitting the streets. On paper, it looks like progress, and to be fair, it does help, at least short term. People get off the street, they stabilize for a while. They get a bed, a shower, maybe a case manager. But here's the catch. The inflow of people is higher than the exit rate. More people are slipping into housing instability than the system can pull out. It's like bailing water from a boat while the leak stays wide open. These programs are built for relief, not throughput. Shelters limited beds, high turnover, strict rules, not designed for long-term stability. Tiny homes. Scalable, yes, but still small compared to demand. Outreach vital, but reactive, not preventive. So even when someone gets help, it's often temporary. Then there's tracking. Very little long-term data shows what really works. Who stays housed 6 months, a year, 2 years? Which programs actually cut return rates? Without that funding, decisions are guesses. And that creates a cycle. Launch a program, then show short-term results, then move on, then repeat. If we don't track what works, are we solving homelessness or just managing appearances? Here's the controversial part. Visible improvement counts politically. Cleaner streets, fewer complaints, better optics. But those numbers don't always reflect real stability. They reflect reduced visibility. The system is running, money is spent, programs are active. On the ground, pressure is still high, until the focus shifts from temporary relief to permanent housing, long-term support, and measurable outcomes. This cycle doesn't slow, it just resets. And every reset pushes more people closer to the edge, while the city keeps calling motion progress. Here's the blunt reality check most city leaders don't want to say publicly. While Miami Beach celebrates its polished 93 unsheltered win, the rest of Miami-Dade County is quietly getting crushed. Across the county, the unsheltered count climbed to 1,184 people, sleeping outside the highest level since 2008, and the city of Miami alone rose 11% to 605. The arrests didn't solve homelessness. They pushed it into the next zip code. We've seen the same pattern in LA, Austin, and parts of New York, where cities leaned hard on bans and sweeps instead of building homes. The visible numbers fall on the expensive blocks, but the total human weight on the streets keeps growing. You see it. That's classic displacement, not an actual solution. Spring break 2026 is already closing in. Tourists are about to pour in, rents will climb even higher, and pressure on every motel room and back alley is going to spike. If the city keeps betting on drone spikes and $294 a day jail costs, instead of switching to real housing first units, we're headed for another year of the same costly revolving door. Families will remain packed into those 300 square foot weekly rooms. Kids will keep bouncing between couches and classrooms, and the hidden 66,000 will keep sliding deeper through the cracks. So here's the uncomfortable question: is Miami truly leading with tough love policy, or is it repeating the same expensive mistake other cities have already shown does not work? The numbers are obvious. Without affordable housing built first, this so-called success is just moving people around and labeling it progress. The next 12 months will prove whether the city finally learns the lesson or keeps spending money to keep the beach looking beautiful, while the real survival crisis plays out off camera. Nothing here is by accident. This is a system under constant pressure reacting in real time. You've seen the pattern. Visibility drops. The numbers look better, but underneath, the weight is still there. People don't vanish. They shift. They compress. They wait. If a problem becomes less visible, does it actually shrink right now? Miami has resources programs and enforcement all running, and yet the cycle keeps repeating. That says something. What if the real problem isn't capacity, but direction? The question is simple. Are we building exits or just managing the flow? At street level, that difference isn't abstract. It determines who finds stability and who ends up circling back.